Thank you. All right, so now I get to talk about Steve. I think he's been a pharmacist for 16 years, is that right? 24. 24. Okay. That was a test. And actually, his dad started the business, and he's here. Jim, do you want to stand? Yay. And Ersfeld Pharmacy has been in business for, I think, 30 years. We have a staff of pharmacists. Chanel Berry, where are you? And Scott Frank is standing. And we have nurses and technicians. Evie Holtz is here tonight, if you want to stand. And we also have a chemist on staff. We're a compounding pharmacy. So, do you know what that means? Does anybody know what a compounding pharmacy does? Nobody? Steve? We do. We can individualize what you need, whether it be, are you a hospice patient or a furry animal? We can do cats and dog prescriptions. Many people are on bioidentical hormone replacement, so we can do those. We can do topicals. And one more little thing on Steve. He's in a fellowship of the American Academy of Functional Medicine. Anything you want to say on that? No? Okay. We did at the pharmacy, we have a nutrition club, and it's called Integrative Connections. And if you want to sign up for that, you can see Evie afterwards, or just come on into the pharmacy and we can sign you up for that. Can you guys hear me okay? Okay. So like Steve said, I've been with Ersfeld Pharmacy for, I think, a little over 12 years. And I've been an RN and tech for, I think, 15 or 16 years now. That's where the 16 years came from. All right, so we'll get started. Tonight we're going to talk about detoxification. So a show of hands, how many of you have ever been to a spa or had a facial or a manicure, pedicure? Hopefully everybody's hand will go up now. A shower or a bath? All right. So just as good as that feels on the outside of our body, that's what a detox or a cleanse does for the internal system. Everybody read that quote? I won't read it. Just memorize it. We already did that. So pollution is basically everywhere. That's no secret. We can find it probably every place on Earth. And if you're wondering how much are we being polluted, if we were to fill a line of semi-trucks from California to Iowa, that's how much chemicals are being pumped into the United States in a year. So these chemicals come from our environment, anywhere from metals and plastics, pesticides, things that are added to our foods, our cosmetic, and even some medication. So I hear this question a lot, and I think I've asked it too. Why is there so much cancer lately? And if we think of the 900 pesticides that are out there, 160 have been classified as suspected carcinogens. One of those is acrylamide, and it's a chemical that's formed at very high temperatures. So when we're eating our comfort foods, maybe French fries or potato chips, we actually get a hallucinogenic effect, and it makes us think we're happy when we're eating these things. So then maybe we eat more. Another thing, so if we don't want to, okay, we know French fries and potato chips are maybe not the best thing for us to be eating. What do we eat? Fruits and vegetables. And guess what? We have pesticides on them. This is showing you a content of highest to lowest. Strawberries being the highest on the list, cucumbers being the lowest. So maybe cucumbers would be a better choice because you can peel them, where the strawberry you really can't. And with all the methyl bromide that's sprayed and put on our strawberries, by the time we get it to our mouth, you know, in the grocery store, they just want it to look good and last longer. But by the time we're actually eating it, we're literally eating a fake strawberry. So antibiotics can be a problem. And the problem with antibiotics is you're taking it and it's killing off the good bacteria in your gut, which decreases your immune system, and more toxins can get in then, and then we're more toxic. So if we were to divvy up all these pesticides between us, it would average out to be 8 pounds for every man, woman, and child. And our poor kids are at risk too. There's a link between toxins and learning disabilities. And even ADHD is on the increase. We're seeing more in the past 15 years than we've ever seen. Also, the playgrounds that our kids are playing on, if the equipment contains arsenic, that's just absorbing right into their bodies too. And the National Cancer Institute says that 80% of the current cancers are environmentally induced. So this would include, this would include things like lead, formaldehyde, and the list goes on. So if we think of our pollutants that we're getting in our air, carbon monoxide probably comes to the mind of everybody, but also ammonia. And of course we can see some of it, you know, in the air, the pollution, but it's also affecting our rivers and streams and places that actually have beaches. Those are even shut down because of too many toxins. So I'm sure we all know about the whole aerosol spray connection with the ozone layer. There's a lot of controversy with that. But sometimes we don't think of just in our own home how paints and the cleaners we're using are affecting our health and our toxic load. I don't know if you saw the table when you first came in, but you can look at that on your way out. That just shows a lot of toxins that are in our house. I guess I never thought about dry cleaning until I was putting this speech together, that the chemicals we're even getting with dry cleaning. So I knew there was a reason I didn't want to buy any more dry clean only clothes. But even things like carpeting, I mean, we're excited to get new carpet. We're getting new carpet. It's going to look nice. But how many of us feel icky or bad after we get that new carpet or new curtains? It's some of the toxins from them, the chemicals. So we're literally drowning in a pool of chemicals. And then we think of our water that we're drinking, and that contains lead and chlorine. But have we ever stopped to think when we're taking a shower or bathing that we're actually bathing in chlorine too, and that's absorbing into our system? Some we even choose, maybe smoking, alcohol. We even need to consider, do we have toxic relationships in our life? Poor diet. The toxins can bind with fat, causing weight issues. Some patients that are dealing with weight issues may find if they do a detox, that may help them lose weight. But I want to let you know there's some good news. Our body is designed to cleanse, but some of these chemicals and things we're exposed to are man-made, and our body may not recognize them and how to break them down. So sooner or later we get bit if our current toxic load exceeds our body's ability to adapt. And this just shows how many toxins we're exposed to, whether it be nutritional, chemical, but sometimes we don't stop and even think of injury affecting our toxic load, or even infection. This is one of my fun things of the night. So as the years are going on, we're accumulating these toxins over time. And first time I ever heard about toxic load, I had a friend actually tell me, she said, well, your symptoms, you're not going to probably notice you're toxic till your symptoms are so bad that your body just can't handle it and it's spilling over. And this is how I visualize it. This is us, and this is maybe how many we have our toxins in our body. You can consider the line here or here, depending on where your toxins are. But every day we're taking these in, and we need to let them out. This is our spigot, which we can consider maybe like our liver or kidneys or just our intestinal health. And if it gets plugged, like the spigot could get plugged, we just keep filling our body up with all those toxins. And every day we take in more and more toxins. You guys see that? If I would have had enough bubbles, it probably would have just bubbled out, but you get the picture. So when it's spilling out, our body is trying to create ways to get rid of these toxins, and those are actually the symptoms, whether it be food allergies, GERD, joint pain. I mean, the list goes on. This is interesting. Most people who think they are tired are actually toxic. How many of us are tired? You know, we're walking around and we're like, oh, I'm so tired. I'm like just in a fog. Maybe it's toxins that are doing this to us. We need to allow our body to rest and detox. And it's too bad that sometimes the price can be too high. I would probably say within the last year, I didn't realize that chronic inflammation in your body, wherever it may be, usually the gut, can lead to chronic disease. So what is this external environment doing to our internal environment? Well, we get symptoms, just like our little thing of water there. We get headaches, fatigue. Anybody think of anything else we experience? Irritability, bloating. Thank you, Renee. Even infertility. That's on the rise. In the last 10 to 15 years, we're seeing more infertility, and that is because these toxins are affecting our adrenals and our hormones. So what can we do? What can we do to protect us and our family? Probably the first thing we need to do is we need to manage the mental toxicity of the daily stress. I mean, we're running ragged. Jobs, everything, kids, family, you name it. So we need to schedule a relaxing activity, whether it be a massage or going for coffee or maybe tea with a friend. I'm trying to give up coffee. So, little things like that can help. This is one of my favorite sayings or quotes when I was putting all of this together. I came across this from Ben Franklin, and the definition of insanity is to do the same things and expect different results. I love that. That every day when I'm like, oh, I'm just going to keep doing the same old thing, eating the same old thing, and I'm like, why am I not feeling better? Well, hello, I haven't made a change. So somewhere we need to change what we are doing. And this is another powerful thing. Only permanent change leads to permanent results. You can just ponder that for a second. Then we'll move on to the car. So, do we know anybody in our lives that maybe takes better care of their vehicle than their own body? Maybe a family member. I think I have one in mine. Anyway, our body wears down like our car, and we feel out of tune, and we feel the imbalance, and we need a tune-up. Does anybody know what your most valuable asset is? You probably all know. It's your health. If you don't have your health, you don't have anything. So we'll move on to the 5 R's of detoxing. You want to remove, replace, repair, retrain, and retest. So we'll go through all those if you get a little confused. The first one, we want to remove toxins in our environment. The chlorine from our tap water, we want to maybe do filtered water. Maybe instead of going and getting fast food, we want to try and find something more organic. We want to also remove some of the sensitive 7, dairy, wheat, sugar, corn, soy, eggs, and peanuts. And then, do we have any disruptive microorganisms in our intestinal tract? We can increase our fiber. This is where our detoxing comes into place. And we want to replace the gut with healthy bacteria, probiotics. Also, we want to take a look at our diet and replace that again with more beneficial food for our body. So we get to replacing water, and even when we think of, okay, I have a filter for the water I'm drinking, but we may want to even look into a filter for what we're showering, our baths, just a full home system for the filter. We do want to repair our digestive tract. Some of the products that we have at the pharmacy contain some of these things: L-glutamine, quercetin. Essential fatty acids will help decrease the inflammation. We want to make sure we're digesting things right. And do we need digestive enzymes? Those kind of things. We want to make sure the colon is healthy. And if we have an unhealthy colon, more toxins can get in and be absorbed. This slide just basically goes through that a healthy gut filters out the microorganisms. Has anybody ever heard the term leaky gut? Okay. I've been a nurse for almost 16 years, and honestly, I think I maybe only heard about it in the last 2 years, maybe a year or two. I had went to the doctor and found out numerous things. I'll tell you about that later. But basically, leaky gut, in your intestines, your cell walls in a healthy gut is maybe like this, and small food particles, maybe get through, but not really big ones. No bacteria, we're not getting bacteria in there. But in leaky gut, your cell walls, something happened along the line, whether it be stress or food allergies or what the case may be. It's like this, and those cell walls are damaged, and big food particles are getting through, and microorganisms and bacteria and pathogens, and that's what's causing us to feel so icky. This was another interesting fact, something called liver time. Between 1 and 3 a.m., your body naturally needs that time to rest, and your liver works hardest at that time. So, anybody have trouble sleeping between 1 and 3 a.m.? I know I have before, and I'm wondering, why do I keep waking up at the same time every day? Your liver is stressed, and it needs to detox. And another thing that I had read is even if you are sleeping, but you're having nightmares during that 1 and 3 a.m., that can be a sign that your liver is overly stressed. So we want to remember that the liver is the organ that's primarily responsible for eliminating these toxins. That brings us to phase 1 and phase 2 detoxification. We basically want to take this fat-soluble chemical or toxin and make it water-soluble so it can be excreted through the body. But we have to make sure that one of the most important things is you have to make sure that that second part of your detox is open. You know, is the patient constipated? You need to address that first, because if you don't, those toxins are going to store those toxins, and you're actually going to feel worse. They're going to just keep recirculating through your body. So this is showing the phase 1 going into the phase 2. This is the part where you want to keep that open so your water-soluble can be excreted. That's as much chemistry as you're going to get tonight. Now I'm going to have Scott set up a little clip. Did that look familiar to anybody? A lot of people? So just as Ethel and Lucy are getting all these chocolates, I kind of foresee that being the assembly line of our gut. Our liver, our intestines, everything. You know, if we're taking in these toxins slowly and giving our gut time to rest and detox naturally, it's fine. But the minute we triple that load of chocolates, just like we saw, and our toxins are tripled, our body starts showing these symptoms because it's stressed with all these toxins. So I don't know if you've ever heard of something called a certificate of analysis. The products that we sell at Erstfeld Pharmacy are pharmaceutical grade. We get this question a lot. What if I just go get any old vitamins or whatever? We usually tell our patients that you want to look for something that's pharmaceutical grade. And what that means is the companies that we work with, if we were to take their product and send it into a lab, they would test for folic acid or, B12. And what they say, let's say there's, 20 milligrams or something. If they say that's what's in their product, that's what's in their product. If a company can't supply a certificate of analysis, who knows what's in their product? Is there any milligrams of that in there? So these are some of the nutrients that we look for in that first part of detoxing. Some of the B vitamins, the folic acid, milk thistle is important. And then in phase 2, we're looking at amino acids like L-glutamine, glycine. We need cruciferous vegetables like our broccoli, that type of thing. Milk thistle is good for repairing. Yep. So you might see it as the name silymarin. It actually comes from, I think it's the Silibin plant that's relative. It's in the daisy family. So. And then we're on to our other R, retrain. We need to eat more vegetables and fruits. Another thing to remember is we need to retrain in order to maintain. One thing that I didn't realize how important this was, sometimes we're so busy in life that, we sit down, we quickly shovel in our food, we got to get back to work, or we got to go pick our kids up or whatever. But we don't know how important it is if we sit down to have a meal. If you can do maybe 10 seconds of just deep breathing, just to calm down the gut, that can make a world of difference, even with food allergies and that type of thing. That would be your beginning. There's other things you need to do. I don't know if you felt like this. I felt like this in my life before, but this is a little comic strip. This doctor or nurse or whoever is telling the patient, I have all the solutions to your health problems. All you have to do is change everything in your life about the way you live. Anybody ever feel like that? I have. And our last R, we want to retest. We want to look at our symptoms. Did they go away? Did they not go away? We may need to follow up with the doctor to see what's happening with our bodies. So we'll review the 5 R's. We want to remove the bacteria and the allergens, replace with probiotics, or do we need digestive enzymes, repair with supplements, retrain ourselves to eat better and our digestive tract to do what it's supposed to do. And then we want to retest our symptoms. We thought this was an important thing in the presentation to let you know that the detox we're talking about tonight is not intended for drug or alcohol. I got a lot of questions on that. What kind of detox talk are you doing? You know, and I was like, more, you know, the whole toxin things, not drug or alcohol. Oh, okay. So we just wanted to clear that up. So this is not suggested as a replacement for medical attention. If you have a lot going on, talk with your medical provider, your pharmacist, your doctor. If you have a chronic condition, please also talk to your medical provider. And that's some of these conditions in here. We do advise pregnant or nursing women to wait until they're done with the pregnancy or breastfeeding, and you maybe after, and you could even do the detox maybe a couple of months before, if you know when that is, a couple of months before you get pregnant. Because what we're doing is we have all these toxins going through us, and this poor baby that's not even exposed to the world is getting exposed to our toxins that we have in our own body. So, how toxic are you? You guys want to pull out your assessment forms and look that over? If you haven't filled it out, go ahead and do so. Many questions on there. Are we tired, fatigued? Do we have headaches? That type of thing. I'll just go through them real fast. You know, how are we eating? Are we eating mostly fresh foods, or are we driving through the drive-thru to get our nutrition? And there's another question on here about the shower filter. And also, what products are we cleaning our house with? I know at my house we're trying to do some more natural cleaning products. I have one daughter that's very... She can be upstairs in her bedroom, and we can spray one little spray on the windows, and she's screaming, "Who's spraying that stuff?" And I'm like, okay, it's not even worth cleaning, but we have to, so just finding something more natural. So back to my car here. Do you ever feel like maybe you're in the wrong lane and you may need to take a different exit with your health? Sometimes looking at the whole big picture is just kind of overwhelming, but if you maybe could just change one thing today and then one thing tomorrow, and I shouldn't say simple things because I used to drink pop once in my life, or a long time ago, and it was hard to give up, just like I'm having a hard time with my coffee right now. But if you could replace that caffeine and that coffee with a little bit more water, those are just baby steps that you could get to. There's many reasons for cleaning or for cleansing. I too did an intake form like you're doing right now, and it showed some major toxicity. And I knew I was having pain. For years I had these body aches that were more of a sawing off pain, like my wrist, my forearm, my legs, and I couldn't figure out why. I'd go to the doctor and they'd say, well, it could be fibromyalgia. But I kind of felt like I was getting that Band-Aid approach, like, well, try this, topical, or do that. And I was like, I wonder why this is happening to me. I did go to Dr. Lanchbury last May, and that's kind of where I figured out what leaky gut was. He did food allergy testing for me, and I knew I had a few I was sensitive to a few things, but when I got my results and he said, you have 37 food sensitivities, he goes, this is leaky gut. Really? Because my gut is fine. I had nothing going on that I knew of in my gut, and he basically opened my eyes to my aches and pains was stemming from our gut. And I don't know if you've ever been told this, but our gut is a mirror image of what's happening on the outside of our body or our symptoms. So are we having skin breakouts? That's maybe telling us that our gut is unhealthy. So here's 3 more reasons why I needed to get on a better path in my life. These are my kids. And, they're energetic and running down this path, and I'm kind of like, I'm not feeling so good. So cleansing was the key for me. When my symptoms do creep up, and if I'm not very good about what I'm supposed to eat, I do fall off the wagon. Vacations are hard for me. My mentality is, I'm on vacation. I can do whatever, and then I get back and I pay for it. So I also think detoxing has boosted my immune system. I know when I first started at the pharmacy, there were many days I called Jim and Steve and said, I'm sick again. And I think it's happening less, I hope. I did have another patient that wanted to be here tonight. She wanted to give you a testimonial of how good she's feeling after detoxing. She actually just did this a couple weeks ago, and she was experiencing more bloating and heartburn and lack of sleep. And before her detox was even up, she had she had contacted me, and she said, Jody, I'm feeling so much better, and I think it's the detox. And she said, I'm sleeping, and she was so excited when I talked to her, and her heartburn was gone, and she actually started exercising again. And I think that's huge when you can actually feel good to want to go for a walk. So is your body giving you signals? At one time or another, we decide it's time to make a change, but are you wondering, where do I begin? How do I do this? Cell Pharmacy is here to help you. We can smooth that path for you. We sell products that we use ourselves, we would give to our kids, our family members, etc. Every one of you, I think, did receive a gift certificate tonight for a free 15-minute consultation. You can come into the pharmacy. You can schedule something tonight, or you can call the pharmacy within the next couple weeks. And you may want to even consider a partner for support. I have a few things to wrap up with, but I was going to let Scott talk about a group detox. There's a lot of us that, with spring here, we want to shed the winter and look forward to the summer. And we've been talking about it at the pharmacy. Some maybe their first detox, and some repeat detox. But go ahead, Scott.